as I said, if anyone has any questions that they want asked, or and I don't see any other questions. I'll leave it to see if the speakers each have any last minute things they want to say in terms of simple solutions for a COVID safe season. Anybody?
I just want to say that, you know, a lot of work goes into this for each of our speakers, you know, the background preparation and that. And I just want to reach out, you know, there's quite a few in this webinar. Please share, talk to your family, talk to your friends, send the word out there because it's so important. Thanks. And thanks to all the guest speakers as well. Thank you.
Anybody else? Jen, do you have anything you want to say it then? I see that you do still wash your hands. It's not entirely only about airborne, well, maybe with respect to COVID, but there's other hazards, right?
Yep.
Well, there is.
What's that, John?
There is somebody with a question with their hand up.
I can't hear you very well with respect to.
There was one question from.
There's a person with a question with their hand up.
Oh, sorry. I'm looking at the questions and I don't have my participant list open to see the hands up.
It's Lily Fit.
Yeah. Hi.
Hi.
Hi. Yeah, no, just a quick question. I'm actually a little confused because right now there's at least one City of Toronto swimming pool that is open, but yet other things are closed. And I did pass by restaurants that are kind of on the full heavy side, but then other places where people are coming in one by one with masks. So it seems to be there's such a discrepancy. I don't know how you can have a pool open, but can you kind of clarify how is that possible?
Well, I'm sorry, I haven't been following Toronto Public Health and any added restrictions they have right now. I mean, we're in the midst of this ramping, I called it a tsunami last week when the news first came from South Africa, and then it's still growing. That wave's growing on the horizon from being really, really small, and it's still relatively small, but we know that exponential transmission is going to have an impact. But I don't think, as I said before, a lot of what Ontario and Canada, or what we call the Canadian 6 provinces, have only watched the metric of ICU capacity and deaths, and have to some extent disconnected, or they thought that cases would be disconnected from that by virtue of the vaccines. And that's not happening with this Omicron variant. So that's what I would say with respect. So personally, I would not go to a pool, although they are great big environments. But the locker rooms aren't, so you don't want to be in a locker room, I don't think. But I don't know with respect to Toronto itself. And as John just tuned in, that yeah, right now it's being left. And I know there was an announcement this afternoon, but I haven't seen that either, although I think that was maybe what you were mentioning, or someone was mentioning, to drop the age for the vaccination boosters, or third dose, as we would say, to 18 as of January 4th. But we haven't actually seen how we're going to even be able to get appointments for the people over 50 starting on Monday, because I had a hard time getting them for my in-laws over 90. Took me several weeks to, I couldn't get them an appointment locally for several weeks. So it depends. And of course, it's the Christmas season. So capacity to deliver the vaccines is going to be a challenge, I think. So, and that's why we need all these other, they're called non-pharmaceutical interventions, all these other protections that we've been talking about today. Okay. So I don't know if, I didn't see David or Ryan. Did you have anything you wanted to say at the end? Have we exhausted it enough for today, and we'll keep our eye on things and try and be as careful as possible.
No, I'm fine. Happy to entertain questions as always.
Okay, and both of you, all of you have I guess, Twitter accounts that people can ask you questions on, and we will, I think, share the slides, I guess. We can post those right away. We were streaming on Facebook, so the video will render and be available right away, and then we will do a curated version divided by speaker to put on our website next week. So if you want to refer anyone to what you've heard here today, you will be able to find it on our Facebook page. And I also want to thank Vonnie and Tony, who are the support people on the WebEx, and I often go so fast I fail to mention them, but of course we could not do it without them. So thanks everybody. We'll hopefully see you next week for more conversations about strategy. And take care of yourself and your colleagues and your family in the meantime. Thanks.